It is the million-dollar question asked by parents with overactive children. When is it time to consider the diagnosis of ADHD? Joining me now with the red flags that you should be watching for is Dr. Bradley Wajda with Esano Incorporated. Dr. Wajda, how are you? Good morning to you.
Good morning.
All right, let's talk about this very serious topic because the definition of attention deficit hyperactive disorder can sometimes be misconstrued by a lot of people, right? Tell us exactly what it is.
Well, very often. In fact, the Centers for Disease Control put out a report in 2008 that said for the preceding 10 years, it had increased 3% every year in terms of the prevalence of the diagnosis. However, again, it is misdiagnosed. There's so many other things that can have an attention problem. But attention deficit hyperactivity disorder actually is a constellation of symptoms that include an attention deficit that presents in a very specific way.
So we don't know the causes, do we, of ADHD yet?
No.
Okay.
No.
There's still no idea what can cause it. But I'm sorry to have interrupted you. You were talking about the indicators that your child has ADHD.
Right. Well, for example, it can be things like your child placing themselves in danger or being accident prone because of inattention. Things that are important to a child. I mean, let's face it, all kids will tell you they've forgotten to clean their room. But if it's something important to them, for example, if they wanted to go to a friend's house at the end of the day and they forget that kind of forgetfulness is a sign of attention deficit disorder. These are kids that will be loud in their play, talking excessively, intrusive, and it's because they're not paying attention. They're not realizing that they're intruding. They'll have trouble waiting their turn in a line or during a game. And you'll even see these kids blurt out answers to questions before you've completed the question because they just assume they know what you're going to ask them. These are kids that'll be distractible. I call it leaving trails. Well, they'll start something, they won't finish it, they'll get distracted, pretty soon they'll start something else, and they'll have these unfinished tasks all over the house.
Well, a lot of these behaviors seem pretty typical for children. Is it something that we should be watching for maybe on a daily basis, or if it happens just every once in a while? How often should we be seeing these behaviors before we say, uh-oh, something's wrong?
Well, when it interferes with a child's level of functioning, particularly their ability to learn. Oftentimes, the very first person who will suspect an ADHD diagnosis, would be the teacher or the pediatrician.
Is it more prevalent in males?
Oh, very much so.
It is, okay.
Yeah, again, CDC in 2010 came up with statistics that said boys will experience ADHD 12% of the time and girls 5% of the time.
Wow. Okay, so let's talk about certain ages. I mean, is there a certain age when you should be looking for it or should be diagnosed?
It needs to be recognized, and it can be recognized after the fact, but the symptoms need to be there by age 7 to officially make the diagnosis.
Okay, so you would have to have seen these symptoms before the age of 7.
Or by the age of 7. Now, the child may be 9 years old, come in with a poor academic record, and when you look retrospectively, you can make that diagnosis because you can see these symptoms were present before. So.
Now, I've heard this, and I may be way off, and it's probably, you correct me if I'm wrong, but I've actually heard that giving them soda or caffeine can accelerate these symptoms and make it worse. You know,
in fact, it's sort of the soda, the sugar can. The caffeine, on the other hand, generally tends to make these symptoms better.
Really?
Well, when you consider that a lot of the medications that we use to treat ADHD are stimulants, and that sounds very counterintuitive. Why would you give a stimulant to a kid who's hyperactive? But to simplify it, the brain works on excitatory neurons and inhibitory neurons or nerves. and they tend to keep each other in check. And in this particular instance, the inhibitory effect from the brain isn't doing its job.
Okay.
So if you give a stimulant, you stimulate that area of the brain to work better, and then that provides the balance.
That's interesting. Okay, you say there's 6 symptoms of inattention: making careless mistakes, short attention span, doesn't seem to listen when spoken to directly, fails to finish tasks. We've talked about these a little bit. Is forgetful, loses important items. But you say there are 6 more symptoms of hyperactivity, impulsivity.
Well, see, there's 3 different kinds of ADHD.
Oh,
there's
okay.
one that's inattention.
Okay.
And those are the symptoms we were talking about. There's another one that's hyperactivity.
Okay.
And then there's a third one that's a combination of those. Okay. And you did mention early on that misdiagnosis is a big deal because there are many things that can mimic ADHD: sleep deprivation, depression, anxiety, even nutritional deficits. There was a naturopathic physician named Alexander Schaus that has a lot of success treating eating disorders, but one of the things that he said was that 15% of all the kids with ADHD have a zinc deficiency.
Oh, that's interesting.
And I've actually treated that, sort of gone on that premise in my practice, and I've seen those numbers empirically.
No kidding.
So.
Well, there is treatment available, which includes medication, behavioral therapy, nutritional therapy, and that is where you come in, Dr. Wajda. So if you have any questions regarding ADHD or have tried other things that don't seem to work, give Dr. Wajda a call at 999-9514. That's if you're here in Fresno, because that's his Herndon office location. And then there's the office up north in Merced at 209-384-0800, and that office is located on Olive Avenue. A lot of great tips, and I know this is a problem for a lot of people.
Yeah, and it's that time of the year. I mean, kids are getting ready to start school.
Yeah. All right. Let's do something about that. Thank you so much, Dr. Wajda, and we will see you again next week.
You bet.
All right. Stay tuned.